Hello and welcome to Business Insight and Plus TV Africa. I'm your host, Justin Akadonye. Now, Nigeria's healthcare systems has for decades been burdened by underfunding, outdated infrastructure, and limited access to quality equipment and services. Now, this has led to not only preventable deaths, but also an over-reliance on medical tourism, costing the nation billions annually. But today, there is a new narrative emerging. A wave of socially conscious investors and forward-thinking startups are beginning to realize that healthcare is not just a moral imperative, it is also a smart economic move. The sector is now being repositioned as fertile ground for sustainable, impactful investment. So how can Nigeria attract the right capital and build a system where health outcomes and investor returns go hand in hand? Stay with us to find out more. All right, welcome back from that report. To explore the financial opportunities in Nigeria's health sector and how investors can become part of this transformation, I'm being joined by Rejoice Chiamaka Azodo, the Chief Executive Officer of Vestitude Partners Limited, a company leading a bold new initiative to close healthcare investment gaps through innovation and strategic partnerships. Many thanks for joining us on Business Insights, Rejoice.
Thank you very much.
Yeah, it is indeed a pleasure to have you.
Thank you very much.
Okay, as a way of breaking the ice as it is right now, why healthcare investment? What's your interest really?
So healthcare investments is because, of course, I've worked in healthcare for about a decade now.
Okay.
And during these periods, I've realized that the biggest challenge is usually funding. I mean, prior to this time, I sold hospital equipment, I set up hospitals and all that. And I realized that there are a lot of hospitals with great potential. I mean, you see that they are doing well, high patient influx, good quality of care. But the challenge is usually the funding to scale. So it's really, really frustrating when you know that there is so much you can do, but you are not empowered to do that.
Okay.
So I asked myself, why not find ways to close this funding gap and empower these doctors?
Okay, so do you really think the Nigerian healthcare sector is ripe for investment right now?
Oh, it has been ripe, Mr. Justin. As a matter of fact, I would say it's been ripe for over a decade. It's just that people are not informed to know that there are opportunities, really, really, really rewarding opportunities. And the beautiful part of it is you are making an impact in the society. And it's not charity. You're not just funding these clinics for the social goodwill. It's double returns for you. In as much as you're doing good, you are also making very good returns.
Okay, so let's talk about, you talked about gaps here when you were talking about your interest and everything. What are these medical gaps or medical infrastructural gaps that you are aiming to fill? Let's say with your approach at Vestitude, what are you looking at really meeting or bridging these gaps?
Okay, so it actually cuts across because we can't talk about quality healthcare if we're not talking about accessibility.
Okay.
I mean, when someone is sick, you need to have the right and well-equipped facilities where you could go to. So a huge part of our conversation is on healthcare infrastructure and medical equipment because these are very important. I mean, we have done so well in basic healthcare, but what about more specialized treatments? What about diagnostic equipment? And you really cannot treat in the right way or offer the best care without the right diagnostics. And these equipments, they don't come cheap. Yes, the government is doing a lot, and we are genuinely collaborators. Of course, they can't do everything alone. So we want to work with them to fill these gaps. And a huge part of it rests on the availability of the right medical equipment and diagnostic tools. And recently, what has been getting our attention recently is cancer care, because it is serious.
Very expensive.
Yes.
Okay, so let's really talk about collaboration, because I understand recently you had a health investment summit which Plus TV actually covered. What was the core message for the investors, the potential investors really?
The core message is driving private sector investment in healthcare, facilitating conversations where people from across multiple sectors can become stakeholders and active investors in healthcare. I mean, you really don't need to be a medical practitioner. You don't need to be a doctor to invest in healthcare. So that was the core message that we had during this summit.
So how is it really going? Because from all I understand, from what I've seen so far, many investors, they usually shy away from healthcare, either due to longer return on investment timelines. How do you address these particular concerns?
Okay, so then again, I would say they are not well informed, because there are lots of opportunities, and we have made it our duty and a goal in Vestitude to bridge this gap, and a huge part of it starts with putting the information out there that there are so many ways stakeholders and investors can collaborate in healthcare. And it doesn't need to be greenfield investments. You don't need to build a hospital from the scratch. And that is also another very serious message we're trying to put out there. I mean, when you build a hospital from scratch, doctors said it usually takes them minimum 5 years to break even. But if you don't want to tour this route, especially for first-time investors who are just still new in the whole health investment, you can go into partnerships, and we facilitate these conversations. There are a lot of hospitals that need medical equipment. You can get involved in funding this equipment purchase, and you get returns on your investment, and you don't need to wait 5 years. By 2 years, you would have broken even. And I'm speaking facts. Yes, I'm speaking financial projections. There are so many other ways. We also facilitate public-private partnerships where you become an active collaborator with the government in funding public health sectors. And those equipments are really needed there because there is a high patient influx, but not enough equipment to serve the growing need. So you really do not need to build a hospital from the scratch. Okay,
from what I see now, maybe let me just get a bit of clarity. So right now the focus is just on the supply aspect and not the demand aspect in terms of, because for the report we just watched, lots of patients usually pay out of pocket in terms of healthcare in Nigeria. So are you looking at bridging that particular gap in the nearest future in terms of what you are doing so far?
So in the nearest future, why not? But there are really a lot of health insurance companies who are really doing amazing job. And we would not want to reinvent the wheel. We want to really focus on where the core is. Because even if patients are empowered to pay for healthcare, or we have some form of insurance that relieves them of that burden, how much of quality care would they get? So we are really focused on these infrastructural gaps, especially bridging access to not just healthcare, but quality healthcare. So yes, we are mostly focused on the supply aspect because really a lot of hospitals, especially public hospitals, they are overwhelmed with demand. They are overwhelmed. Patients queue for hours just to get the right care. And that is because these equipment are not in adequate supply. So we already have the demand. It's been established. We are focusing on bridging the gap to in terms of supply, and a huge part of that conversation has to happen around funding.
Okay, so speaking of funding, so what is Vestitude bridging, especially between the gap of philanthropy and of course for profit?
Okay, so like I explained, right, it's not entirely charity. Of course, there are organizations that donate medical equipment as part of their CSR. And I really encourage a lot of organizations to do that. Because we see organizations that fund clearing of road and distribution of school bags, and they are doing really great job. But we want them to also look at healthcare, because healthcare is really suffering. And healthcare is something that touches everyone in the society. So yes, we have initiatives like that where companies can partner with us to do healthcare CSR. But it's mostly about return on investment for private investors. And I guarantee you, these hospitals, we don't overburden them with high interest rates. Because then again, if the interest rate is as high as commercial banks, how are we really solving this problem? So it's just a balance between social good and returns on investment for private investors.
Speaking of equipment, modern equipment and hospital equipment, technology as well. So what are the specific types of maybe equipment or maybe technology are most urgently needed and the most investable?
Okay, so for right now, we are mostly focused on very specialized care,
Such as?
like dialysis.
Okay.
We're doing a lot around the dialysis space. We're setting up dialysis clinics at no cost for hospitals, and they can pay back in as much as 2 years, 2 to 5 years. So it relieves them of that burden. We're also hugely focused on diagnostic equipment like CT scan, MRI, and a huge part of what we are doing is also on cancer care, especially radiotherapy equipment.
Okay, so in the long term or maybe short term, it just occurred to me now, would this actually address the challenge and the profits that are being lost through medical tourism?
Oh yes, as soon as we bridge these gaps, people don't need to travel outside the country to get care, because medical tourism is because of the poor quality of care people think they are getting within the country. So why travel abroad when what you are looking for is here? And that is a huge part of what we are doing.
Yeah. If, for instance, I'm interested, I'm a journalist, I'm interested in investing in healthcare. Maybe I have some shares and stocks, and I really want to convert them to medical or healthcare investment. What do I really need to do, and how long or what kind of returns can I expect?
Okay, so it's very simple and straightforward. First of all, you have to come to us in Vestitude so we can guide you. And that is also because we have a lot of hospitals on our list, on our waiting list actually, who are ripe for investments. Okay. And of course, we have to verify that they are investment worthy and they have the capacity and credibility to return on investment. Then after us, we facilitate the conversation between you as the investor and the hospital as the off-taker. And you can be looking at 2 years.
2 years?
Yes, even 2 years minimum to at least break even.
Okay.
Yes, and that is when you are not doing a greenfield investment, like I said, when it's more like a joint partnership.
Okay, break it down, because some people, when you say that greenfield, some people might just really not understand what you mean by greenfield, but maybe might need to just break it down so maybe potential investors or just health enthusiasts can really understand.
Okay, I mean building a hospital from the scratch.
Okay.
Because that's if you take that path, it takes a longer time. But when you go into collaboration with hospitals, sometimes they start paying you back in as much as 3 months after the investment is ripe. Because these hospitals is not like they are not profitable. They are just not empowered enough to take up that huge financial burden of that initial cost or capital needed to make that investment or acquire those medical equipment. So yes, well, by the time you invest, sometimes in 3 months they have started returning. Yes, they start paying you back, and they can pay
start money into the bank.
Oh yes, and they can pay you off within 2 years. Some even pay off before 2 years.
With interest.
Yes.
Okay. Because I'm an Igbo man, I have to think about the money. Let's talk about public-private partnership, which you mentioned in passing. So, what role do they play in scaling investment or this particular investment model?
Okay, so the role they play is mostly bridging the gaps in terms of medical equipment. So the investor can fund the purchase of the medical equipment in these public hospitals. Of course, we are the middle all the while to ensure that your investment is safe. Because in as much as we facilitated those conversations between you and the hospital, we have to take it up as our own responsibility to ensure that you return on that investment. So yes, it's a win-win for everybody. You purchase or you fund the purchase of medical equipment. The hospital in return makes use of those equipment and they generate funds. And of course, you return on your investment.
Lately, everyone is talking about social impact, worldwide. So how do you measure or maybe strike some sort of balance between financial and social impact in your model?
Okay, so I think the best way to answer this question is to cite this example.
All right.
So I have this project we just completed in Port Harcourt with Data Medical Center in Port Harcourt. We set up
Data Medical have to pay also for advert.
Yeah, to set up this dialysis center. So it was named after a patient that they lost because then they didn't have a dialysis clinic. Okay. So if we are to measure social impact, we would have said first of all, we are going to revert those predictable deaths. Right? So if they had dialysis care, then the patient wouldn't have tried moving a long distance for dialysis and wouldn't have encountered the crisis he did in the process. So first of all, we are talking about averting preventable death. We're talking about reduction in patient waiting time to get treatments. We're talking about improved quality of care. So to measure the social returns or impact would be huge. And in terms of financial impact, of course, you are returning on your investment. It's not free, it's not charity. So it's a win-win. We are building the society, and in return, you are also augmenting wealth for yourself. And don't forget, healthcare is something that affects everybody's lives.
It does. It does.
Yes.
Okay, let's look at the long-term, benefit or long-term, perspective, projections, and everything. I'm trying to see if there can be some sort of intersection between the healthcare system and maybe the capital market, because right now I know you do a bit of short-term finance and everything. In the next 5 to 10 years.
Okay, so in the next 5 to 10 years, our target is to ensure that Vestitude or health investment is on the table when we are discussing investment options. You are talking investing on stocks, you're talking investing on bonds, you are talking treasury bill, and you are talking health investment. I'm not saying it's going to be an option you would consider. It is part of what is available for you to choose from.
Do we have something like that right now, healthcare investment on the capital market?
I would say we are pioneering that conversation right now in Nigeria.
Okay.
And that is what is really, really important to us. You are considering healthcare or treasury bond. You're considering healthcare or fixed deposit. You're considering healthcare or stock. You're considering healthcare or bond. So everybody is informed that healthcare investment is a rewarding investment vehicle, and it comes to your mind for each time you are considering investments.
So generally, what's the outlook for healthcare investment in Nigeria or maybe Africa in the next 5, 10 years? Do you see it becoming like a boom? It's something that will just blow in people's faces and to be a completely different narrative. What do you see in 5, 10 years healthcare investment generally in Nigeria?
I think five years is actually too long for us to see the results, because
really?
It was amazing during the investor summit. We had CEOs from different oil and gas companies, real estate companies, fintech. I mean, these people were not healthcare professionals, and they were all not just excited about the returns, but most importantly about the social impact and the fact that we are building a better society. So yes,
there's
5 years too far.
So you're saying that in the next 2 years, we'll brought you here in 2 years' time, and we'll be singing a completely different tune.
Yes. When I'm here in 2 years' time, I'm very sure you would have somehow probably invested in healthcare somehow.
Obviously, I should. Health, they say, is wealth. And from what you're saying, from this model, if everyone should be thinking of investing in healthcare financing, because at the end of the day, you're not just meeting a need socially, you're also making some returns for yourself.
Definitely.
All right, healthcare is more than a moral mission. It is an economic catalyst. What we've heard today underscores the power of innovation and intentional investment to drive change where it is mostly needed. A healthier nation isn't just a goal, it is the pathway to prosperity. Many thanks to you, Rejoice Azodo, for your time on the show today. We do appreciate it.
Thank you very much.
All right. Well, that's it for this edition of Business Insight. I'm Justin Akadonie. Many thanks for watching, and see you again next time. Bye for now.